The mucopolysaccharidoses, MPSs, are a group of rare genetic lysosomal storage diseases caused by deficiency of lysosomal enzymes that catabolize glycosaminoglycan (GAG) degradation. The GAGs themselves are waste products of larger molecules that exist at the cell surface or in the extracellular matrix, which then enter lysosomes for intracellular digestion. The MPSs are categorized into types based on a specific enzyme deficiency. A deficiency in iduronate 2 sulfatase, the enzyme that catalyzes the GAG's dermatan sulfate and heparin sulfate, is referred to as MPS II or Hunter syndrome. MPS II is an X-linked recessive disorder that primarily affects males. Without sufficient levels of iduronate 2 sulfatase, GAGs progressively accumulate within the lysosomes of nearly all cell types. This leads to progressive cellular damage and multiple organ dysfunction. It is this accumulation of GAGs around the body that contributes to the signs and symptoms of Hunter syndrome, many of which are somatic. Oropharyngeal and tracheobronchial deposition of GAGs affects the respiratory system and leads to severe airway obstruction. Storage of GAGs within cartilage, bone, and connective tissues may contribute to the musculoskeletal manifestations of the disease. GAGs in the heart, liver, and spleen may contribute to cardiac and gastrointestinal symptoms. Pathological accumulation of GAGs in the brain can lead to a severe clinical phenotype. Hunter syndrome was traditionally classified into 2 distinct forms: the severe type with central nervous system involvement, and the attenuated type, which means there's no neurological involvement. However, the phenotypic expression of Hunter syndrome is now thought to span a wide spectrum between these 2 types. 2/3 of patients have the severe form, with clinical features typically appearing between 2 and 4 years of age. Patients may have profound cognitive impairment, severe behavioral problems, and neurological decline. At the opposite end of the spectrum, signs and symptoms may not emerge until late childhood or early adolescence in the attenuated form, and neurological dysfunction is minimal. A large number of mutations have been reported for the IDS gene that encodes the enzyme iduronate 2 sulfatase. Large deletions or insertions, complex rearrangements, and nonsense in splicing variants are commonly associated with severe forms of Hunter syndrome. Due to the rarity of MPS II and the high number of genetic variants for the IDS gene, a clear genotype-phenotype correlation has not yet been determined. If you suspect that your patient might have MPS II, refer them to a geneticist today.